Hi, everyone. My name is Coutinho. I work in the space of integrative and lifestyle medicine. And today, this is actually the first time we have invited two very renowned and special doctors on board. Okay, we're on Real and Raw right now. And the reason we have Dr. Dheerja with us and Dr. Aayush. Dr. Dheerja is the head of physiotherapy in a renowned hospital. And so is Dr. Aayush. He's a diabetologist and MD in medicine. But it's something really exciting today. Dr. Dheerja is currently COVID positive day 4. And I feel bad stealing her time, but guess what? Have a look at her. She's glowing. Her oxygen saturation levels are excellent. And she owes it to the amount of care she's taking for herself and the breathing exercises that she's doing. And she's going to teach us these breathing exercises today that can help millions of people out there. You may have a symptom, of course, always take medical advice. But today, these are simple breathing exercises that work on the simplicity of science and anatomy that can help you right now, no matter where you are. You may be in a COVID facility, you may be at home, you may have COVID, or you may be looking at prevention. But we always say that the simplest lifestyle changes and the power of your breath is something that a lot of us do not explore. So Dr. Dheerja, thank you so much. Can you take a minute to introduce yourself? Can you please introduce yourself, what you do, what you studied, and then we'll move straight into the exercises.
Right. Thank you so much, Luke, for introducing me and having me on this video. The whole purpose of this is to help other people. And since I'm COVID positive, I'll tell you honestly, my saturation went down up to 95, 94. And with the exercises, what I've been doing, these are very simple, basic exercises. The people in isolation at home, even in hospitals, they can do these exercises, and easily available stuff like balloon and water and the straw, they can do it. I'll just demonstrate how to do it. Because what happens generally in COVID-19, the fluid articulates in the lower areas of our lungs. Okay, so that leads to the discomfort and the saturation falling down rapidly. So if we are doing these exercises, we are expanding our lungs and we are not letting the fluid to articulate, to fix up down in the lungs, and it cuffs it out and it comes out. So then the saturation improves. So easily accessible thing at home is the balloon. What we are doing with this is we are blowing out air against resistance so that it will create a positive and expiratory pressure in our lungs. This is similar to what we give like a ventilator in the hospital. So with this, if we are keep blowing it out and giving the resistance to our lungs, it's going to open the tiny air spaces inside the lungs. And the saturation, you will see magically it's rising with this simple technique. So I'll just show you, you have to blow it 3 times with a deep inspiration in and that expiration with the pressure in this. So how to do this? Just make sure that you're not using your accessory muscles. So we just have to use the lung muscles and the diaphragm muscle for that. The other simple technique is just take water in a glass or a jar or a bottle and a simple straw easily available at home. We have to blow out balloons in the water like this.
The bubbles, yeah. Okay. So this is one breath, right? You've taken one inhale and through one whole exhale, we're blowing bubbles through the straw. Okay.
Expiration should be longer than inspiration. That's the key for that. So it's like, again, inhale, just do it 3 times all together. So this is the gentle way of getting the resistance. Like if people are not able to do this, like the elderly at home are not able to do the balloon, they can do this, making the bubbles in the water, and they can just imagine that they are blowing the balloon without the actual balloon, just like this. Inhale. It's like a pursed lip breathing. This really helps these smaller alveoli in the base of the lungs to not collapse. It keeps these exercises, keep the lung airways patent. These exercises keep the lung airways open, and the expansion is there in the lungs. So the moment they'll do this twice or thrice in a day, and every time three repetitions, because we don't want muscle to be fatigued and tired, because they're suffering from COVID also. So they have to take care that they have to give a break also in between and then do these exercises. These are very simple techniques. Anyone can do it. They will see the result. And this is the whole purpose of making this. And another one major point, Luke, I want to add.
Sure.
Nowadays, people are aware about proning, right? It's very now has come up in highlight. Reason being, what is proning? First is lying upside down on your stomach is a prone position. Okay.
Right.
When we lie down on our stomach upside down, what happens? Because the major part of our lungs are located at the backside. This many people are not aware of. Okay. So if we lie down straight for a longer time, like on our back, like this, if we keep lying down straight, and when we are having COVID, we are going to compress the lung airways.
So expansion
So
is not
that
going to
is
happen completely.
exactly. And the unfortunate part is, since it's COVID, so a lot of secretions are already coming in. Right. So if you're lying down straight, we are going to be more breathless. Our saturation is going to be more down. So in order to avoid it, and in order to have a good expansion of lungs, we should lie down upside down on our stomach.
Right.
That is going to increase the lung airways, lung expansion, and it's going to bring out the secretions with these simple exercises and lying down prone. Now the government has been also sending messages and showing that the demonstration of lying upside down on your stomach helps. But make sure, if you are a heart patient with the surgery, and of course pregnant female, you are not supposed to do it.
Perfect. Perfect. I think that's brilliant, doctor. And I like how you explained it, because, you know, there are so many mixed notions about what is the correct position to sleep. And most people lean to, when we do diagnosis of people with sleep apnea and all their sleep problems, all of them have always been advised to sleep on their back, apparently. And I think it's amazing how you've integrated science and anatomy, and it makes complete sense. It makes complete sense what you're talking about. So there are 3 exercises that Dr. Dheerja has spoken about. One is a balloon, and you blow out into the balloon, and again, you take a deep inhale and try for the exhalation to be longer. If you don't have a balloon, you can mimic the same breathing exercise in a way that we call pursed breathing, or you can imagine you're breathing that way. The second is our favorite, because as kids, we were always told not to blow bubbles in our soda bottles and our glasses, but now we all have permission to do that. And I think it's so simple and so powerful. And the third is sleeping on our chests if we're not pregnant, and if we don't have a heart problem or we've not gone through heart surgery, and trying to sleep through that position and breathing for complete expansion of the lungs. Doctor, I like what you suggested, because a lot of people are going crazy with breathing exercises. They're overdoing it, thinking that the more they do, the stronger their lungs are going to be. So I like, let's see that. What's your saturation?
I'll just show you. It was 95 before, now it has reached 99. Oh God.
99. I can see 99. Fabulous.
Yes.
Fabulous.
Yeah.
And when you got diagnosed, you were at a saturation of 94 or 95.
Yeah.
Okay.
Yeah.
Brilliant. I think this is leading by example, and try it. We lose nothing by trying these things. Right now, everyone's a victim of fear, a victim of anxiety. And like I always say, you're a victim of fear and anxiety unless you take action. You do something. So start doing these things. You know, these things are so important. They're the basics of science and anatomy. And if we can do it, and we can change our saturation levels at home. Again, if you have symptoms, this is not a replacement for your medical doctors or anyone. These are things that can help us. But like any doctor would advise you, if you have symptoms, if you have comorbidities, please go and see your doctors. Dr. Aayush, since I have you online, I would like you're seeing a lot of diabetic patients right now with COVID. Give me 3 of your top lifestyle changes or advice that you would want to leave with patients out there who are diabetic and going through the COVID right now.
See, with COVID, basically the drugs that we are giving can cause the sugar levels to increase. With an increasing level of sugar, the viral infection tends to spread further. The control in the body becomes poorer. And patients then get confused, sir, we are getting very high sugars. We are not eating anything random. We are not eating anything sweet. So what I would like to advise is that the patient should decrease the meal size and it should distribute the meal size into small portions. So instead of having 3 big meals of a big breakfast, a big lunch, or a big dinner, they should divide them into 6 meals with 3 small meals and 3 mini meals. All right. So those include 3 breakfasts and 3 mid snacks. So that way the patient is not hungry whole day. He is not feeling like I have not eaten anything and my sugar might go low. But with the regular intervals, with eating regularly, they will also keep rejuvenating themselves. They'll keep eating something, and the sugars will also not jump very much.
Spike up, yeah.
You understand? So that is one of the important things that I'd like to let them know. Secondly, while with the breathing exercises, people tend to overdo them. They tend to do over. They have not done enough, or they're not exerted enough. So I would like to let them know that slowly and steadily doing any exercise is better than extra number of repetitions. So number of repetitions is not important, but doing it in the right way is very important. As ma'am has been very specifically telling that the inspiration duration should be smaller than the expiratory duration for the blowing out exercises. For exercises where we are taking in, there we have to equalize the duration. So that's the second tip regarding that. And thirdly, that any diabetic patient should regularly check their insulin and regularly check their sugar levels. If their sugar levels are under control, so once daily is good enough. If their sugar levels are not meeting their targets, then it is advisable that they do it once in the morning, empty stomach, and once 2 hours after meals, so that they should know how the body is responding to the meals that they're taking and if any modification needs to be done accordingly.
Perfect.
People cannot go out right now. So my last third tip will be to do exercises at home. Ma'am is an expert in exercises where patients cannot move. She has been dealing a lot with patients who have got their knees transplanted. And so those exercises where patients do not have to even stand and yet they can burn their calories and improve their output can be done. So, ma'am has a lot of knowledge that you can ask her to give more inputs about. So those will be my 3 basic tips so that everything can be at least taken care of. And whatever expert opinion they might require, then the family physician or the doctor who is nearer to them, who is taking care of them, will always tell them better, because diabetes needs a lot of individualized care rather than we giving general concepts, because not everybody has the same body.
Thank you, Dr. Aayush. I appreciate your holistic, approach towards disease. And I think that's what allows people to recover. And Dr. Dheerja and Dr. Aayush, of course, we're going to steal some more time later on a specific video, because I want this to be very specific to people learning the breathing exercises that y'all are demonstrating and talking about. Dr. Dheerja and Dr. Aayush, thank you so much for being on this particular show, because we believe it's the simple things in life that work. And y'all are adding so much of value by putting this out there, so much of value by putting it out there. And I think, Dr. Dheerja, you're a living example of being COVID positive, but you're out there helping people, spreading the information that can help us through these dark times. But thank you so much for your time. And
thank you so much,
to both of you again very, very soon.
Thank you.
Yeah, get well soon.
Thank you.
You already look fine. You don't look like you're going through anything, to be quite honest. So something's working for you. Brilliant.
Yeah. Thank you so much.
Thank you so much. Thank you.